some really interesting data presented at ESMO this year. Besides Flora, besides Pacific, which made the presidential symposium. Going back to Friday's session, we're all looking at the 21G Merck trial, and this was a small phase 2 trial. It was not large. It was not phase 3. It was a cohort on other trials that looked at pembrolizumab plus chemo independent of PD-L1. They found a very high response rate in those patients that were giving pembrolizumab and pem-platinum of around 56%. And with that phase 2 trial, the FDA actually approved it. I think that most of the world were in shock. Most of the academic oncologists in the United States were also surprised. Dr. Gandera, when on his first abstract, when he was asked the question, said he disagreed with the FDA. But I think all of us are very interested in following this trial to see what becomes of it as the phase 3 trial is being completed and will be presented in the next year. So 21G, basically every time we come to a meeting, the overall survival is being presented as well, because that's what we want to see. And at the very first time it was presented, and I'm going back now to ESMO or World Lung last year, Corey Langer presented it, and the real overall survival was hit a hazard ratio of 0.9. But at ASCO, surprisingly, the overall survival went to about 0.6, I think 3. It actually improved, and most of us were very shocked by this. So at this year ASCO, they presented it again, and it's not significant. It was 0.59, so it continues to improve. The p-value was 0.03, and many people have already emailed me and asked me, isn't that significant? But it was one-sided, so they had to meet a 0.06, and they didn't. And that's important to remember, that this was not significant. But the other thing that's really interesting is that overall survival continues to improve, and it's a sort of a signal with IO drugs that PFS is important, but OS may be even more important. These drugs seem to be carrying a percentage of patients further along that curve to be stable or live with their cancers without progression. So I was really impressed by the KEYNOTE-021G trial, and I follow it very closely as well.